This video continues Chapter 17 of OEC 6, looking at obstetric emergencies, and in particular we're going to focus on the assessment of a female patient who may have abdominal or pelvic pain and is pregnant. Let's begin. One of the keys to be aware of is we always want to respect the patient's privacy and dignity, so we can, in a non-invasive way, get an essential obstetric history, but we should do this in a private manner where others cannot overhear. It is very unlikely that you would ever have to expose or undress a woman in the outdoor environment for a physical examination unless you actually knew that there was perhaps urgent bleeding that would be occurring. It is best to wait until you're indoors, say in your first aid room, and also maybe call for a female patroller to assist and improvise some screening if possible. Many first aid rooms will actually have curtains available between some of the beds that we find there. When examining a non-pregnant woman who has abdominal pain or vaginal bleeding, make sure to place her in a position of comfort, which is going to be typically supine, perhaps with the knees flexed. Look at the abdomen first, note any distension or discoloration. Allow the patient to point to where the pain is most intense. This could be parietal, could be pinpoint, could be visceral, and a little bit more diffuse. And always recognize the conditions other than pregnancy may be the cause of the pain. If you need to palpate the abdomen, do it as we typically do in assessment and just consider all four quadrants. OEC technicians should not examine a non-pregnant woman's genital region unless there is ongoing hemorrhage. If the responder is male and a female OEC technician is available, we should consider having the woman conduct the exam. Now, for a pregnant woman, just consider whether the uterus feels that it may be contracting at a particular time, and notice if there's any tenderness upon palpation. If the uterus is easily palpable, attempt to detect any fetal movement, which can occur in the second trimester. Always remember, during the exam of a female patient complaining of abdominal or pelvic pain, to consider the patient's dignity and, when possible, see if a female patroller is able to respond.